So my project was about autism in the juvenile justice system, and just some background information about why I think it's important to explore this issue of folks with autism and their encounters with law enforcement, juvenile justice folks. So in 2016, Charles Kinsey, who's the man lying on the ground, he's a behavioral therapist working in a group home in North Miami. And the man next to him is a 23-year-old man with autism spectrum disorder who left his group home. In his hand, he has a silver toy truck. And Mr. Kinsey was trying to get the young man back into the group home. Happened to be at the same time, a police officer, Jonathan Aletto, responded to a call that a man was threatening to shoot himself and had a gun in that same neighborhood. Officer Aletto came over to this scene of Mr. Kinsey trying to get his client back into the group home. He believed that the man with autism was the man threatening to shoot himself, and the silver toy truck in his hand was a gun. Officer Aletto instructed the young man to drop what he believed to be a gun. Mr. Kinsey was trying to explain to the officer that it's not a gun, it's a toy, and that this man has autism. The officer did not believe him and shot 3 times, accidentally hitting Mr. Kinsey. And the trial for Officer Aletto just concluded with a mistrial. So they're debating whether or not to retry him for basically shooting at them for no reason. And just some further background about the juvenile justice system in general. So psychiatric comorbidity is extremely common amongst youth in the juvenile justice system. In a study in the Chicago area where they surveyed about 1,200 young folks in the juvenile justice system in Cook County, they found that 60% of juvenile detainees over a 6-month period qualified for one or more psychiatric disorders, not including conduct disorder. So this included diagnoses such as depression, anxiety, ADHD, substance abuse. And they also found that intellectual disabilities and learning disabilities were also quite common in this population. And while they're supposed to screen for psychiatric morbidities and risk assessments, safety assessments, screening for autism spectrum disorder is even more limited. And the ability to treat someone appropriately with autism is even more limited than that. And in another survey done a few years ago, through Parent Report, they found that about 11.4% of youth already diagnosed with autism had been involved in the juvenile justice system within 6 months of that survey being conducted. My research was done, or my program was done at Sacramento County Youth Detention Facility, where I've been working as a child and adolescent psychiatry fellow for the last couple of years. And just to get an idea of what the youth detention facility kind of looks like. So their average daily population in the last few years is about 130 young folks. Of those, about almost 90 of the young males there have felony charges, oftentimes very violent felony charges, and about 17 females at any one time. Their average length of stay is 28 to 30 days, so not an insignificant amount of time, even for those who may have misdemeanor charges. They have what's called a special needs list, and this is a list of folks who may have specific medical concerns or psychiatric concerns, who may have intellectual disability, autism, things like this, where the mental health workers, the psychiatrist, and now the child and adolescent psychiatry fellows who rotate there may interact with them, assist the probation staff in learning kind of how to work with that young person who may have some special needs. And currently there are about 44 open mental health cases. So this means that they may be taking psychiatric medications or actively involved working with the mental health staff at YDF. But the actual number of kids who are taking psychiatric medications is actually much more than this. They may just not have open mental health cases. All right, so my intervention at Sacramento County Detention Facility, knowing that background, so I created a training for all of the probation staff at Sac County YDF about autism spectrum disorder. I provided some pre and post surveys to get an idea about their knowledge and comfort level working with kids with autism, and then after the training that I gave. And it happened to be that while I was there, they actually had 2 kids with autism spectrum disorder while I was there, so created a lot of great discussion. So this is the pre-survey data. So as you can see, most did not have any sort of training before mine about autism spectrum disorders. The vast majority wanted to know more about neurodevelopmental disorders and autism. Also, the vast majority says that they had encountered children who have an autism spectrum disorder diagnosis, either at YDF or at a previous job. And it's a bit mixed about if they feel like they have a good understanding of what an autism spectrum disorder is. And a lot of people said they weren't quite sure. And then I also asked if they felt comfortable or confident working with children with an autism spectrum disorder. And most said somewhat, but there's quite a distribution, a wide variety of comfort levels. And it seemed like a good amount had little confidence or no confidence whatsoever in working with kids with autism. So my actual training was about a 30 to 40-minute presentation. I met with all the probation staff over the course of a week when they have their monthly unit meetings, and so I probably gave about 5 presentations every day over the course of a week. I got really good at giving my presentation. I discussed just kind of general symptoms and signs of autism spectrum disorder that are pretty common. I actually went through the DSM-5 criteria because I do think that this is important, not only for us as mental health professionals, but I think for people working with young folks who may have autism to really understand what it is that we're looking for. I went through some statistics and demographic information about children with autism, and then some specific behaviors that they may encounter as law enforcement, as probation staff at a juvenile justice facility, and specific interventions that they can use as probation officers, law enforcement personnel. And some specific tips and recommendations working with kids with autism. And so, just a little sample of some of the slides that I showed them. So this is one of them that I showed about possible behaviors that they may encounter or that they may come across, is that kids with autism may come across as a poor listener. They may repeat words, statements, body language. They may make some brutally honest statements. And they probably have little to no understanding about body language, sarcastic statements, metaphorical statements, things like that. And then these are just some of the general tips, some of the tips that I gave them about how to work with someone with autism. So again, kind of avoid those sarcastic, metaphorical statements, that limited eye contact does not mean disrespect or deceit, which I think oftentimes, especially in law enforcement, they really misconceive that. And so my post-survey data, so I immediately gave a post-survey asking similar questions about how they, what they thought about the presentation and how comfortable they feel. So as you can see, there's been a huge jump in people feeling like they feel more knowledgeable about autism spectrum disorder. They want more trainings about autism and or developmental disorders. They felt like the training was useful and they'll be able to use this information in their workplace, YDF. And asking about how confident or comfortable they feel working with someone with autism. So now there's been a huge shift in people feeling a little bit more confident and comfortable knowing kind of how to work with a young person with autism, which is very encouraging to see. So just my future directions about with this training. So I would like to incorporate more trainings with probation staff about a wide variety of neurodevelopmental and psychiatric issues. ADHD, trauma, conduct disorder, intellectual disability, these are things that they run into all the time. And so my hope is, so a first-year child psychiatry fellow, we rotate there every 4 months. So my hope is that each child psychiatry fellow will be able to incorporate a training during the rotation. And then one probation staff actually asked me to give this to attorneys, judges, all sorts of people. And I was like, yes, if you can get me in contact with them, I will. But that's just another idea that to really extend this to all sorts of folks who are on the front lines of the juvenile justice system and law enforcement in general.
The UC Davis Mind Institute was created in 1998 with a promise to find cures for neurodevelopmental disorders. Every day, our physicians and researchers come closer to fulfilling that promise. Their groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other brain disorders are helping children achieve their fullest potential. Please visit our website to find out more about current studies, upcoming events, and how you can help make a difference.